Well, my name is Anusha. My husband's name is Dr. Prasanna Kumar. He works as a senior scientist in APC. We live in Dublin.
I am Dr. Deepak Jayaprakash Kaddu, urology consultant at Manipal Hospital, Whitefield. So it is a slightly interesting story how I met this patient called Anusha. One of our staff came with the reports on the mobile saying that the patient, one of the relatives of staff, is admitted in Dublin, Ireland.
Last month 20th, I have started with a terrible pain in the abdomen, and I had a problem with passing urine as well. So I have been admitted in the hospital in Dublin. For 20 days I have been in a terrible pain, and I have been with the catheter. So there they didn't diagnose anything properly for 20 days. After that, when we sent the reports to my brother-in-law, he spoke with Shanmugam, who works for the lab here, and he referred to Dr. Deepak.
So after seeing the reports and listening to the history of the patient on mobile phone, international call, so I came to the conclusion this is an intraperitoneal perforation of the bladder, and we have to operate this at any cost as early as possible. And there the patient was admitted and doctor were not ready to operate. So I asked the relatives to get discharged from there and come to India, we will operate here. So the patient traveled all along from Ireland to India, came and admitted in the emergency, and we did a CT scan, CT urogram, which was showing very small bladder perforation, which was found with the difficulty to the radiologist. So we decided to proceed for the surgery.
When we spoke with Dr. Deepak over the phone, he said that he will take care of the surgery and he will plan everything according to the things to sort out my issue. So all through the way we fly from Dublin to here, and after coming here I admitted in the hospital. From that day they have taken some scans they have done. After going through some scans, Mr. Raghu, the radiologist, and the Dr. Deepak, they both had a discussion. Immediately they had planned a surgery for the next day. Then after the surgery, I have been kept in observation for 10 days. My surgery has taken place on 16th of this month.
Looking at the history, there was no history of blunt trauma to abdomen or any gynecological or obstetric surgery recent past. That bladder perforation diagnosis was slightly dubious, but we decided to go for a robotic surgery so that we will not falter in any of our operative skills during the surgery. So after doing the CT scan, we decided to go for surgery. We did the robotic surgery and we found out there was a small bladder hole which we closed perfectly, and after 3 to 4 days patient was discharged. Patient intraoperative and postoperative course was uneventful. Patient was absolutely fine, and after 14 days we removed the catheter after doing an cystogram confirming there is no leak from the bladder. So at present the patient is without catheter, she is walking, talking without any complaints, no abdominal pain, and she is perfectly alright. So the patients and the relatives were very happy that we have took her out of the problem which was, she was in confusion whether to go for surgery or not, and finally the results are good. And this was my first robotic case in Manipal Hospital robot. We just got our robot 14 days back and the case went well.
So by this time I'm completely fine, absolutely I'm able to do the normal works, and I appreciate Mr. Shanmugam who referred to Dr. Deepak and the team who worked really very hard in my surgery, and they have taken the good care of mine, and I thank you for the Manipal Hospital. Thanks a lot.